Marble sphingolipid biosynthesis regulator 3, balanitis succinata, and tonsillitis are the symptoms we're dealing with here.
Most symptoms could point to a few different conditions.
Could it be Goucher disease, perhaps?
No, I think it's more likely to be Farber disease. The symptoms match up quite well.
I disagree. I believe it's Niemann Pick disease. The combination of symptoms fits better with that diagnosis.
I'm leaning towards fucosidosis. The symptoms seem to align more closely with that rare disorder.
Enough. The correct diagnosis is list of disorders included in newborn screening programs. We need to perform wide local excision immediately.
But Dr. Hawks, that procedure is highly risky. Are you sure that's the best course of action?
I am sure. We cannot delay. The patient's life is at stake, and I will not lose another one on my watch. Prepare for surgery, all of you. Tracy, I've called you here because I truly believe that performing a wide local excision on my patient is the best course of action. This patient shows symptoms that align with the list of disorders included in newborn screening programs.
Hawks, I understand your concern, but we need to be cautious here. Have you considered all possible options and consulted with other specialists?
Of course I have, Tracy. I have years of experience in this field, and I know what I'm doing. You can't just question my judgment like this.
Hawks, I'm not questioning your experience, but I can't ignore the fact that you have a track record of jumping to conclusions and being wrong. We have to be thorough in our assessments before proceeding with any procedure.
This is different, Tracy. I have a gut feeling about this patient, and I'm confident that wide local excision is the right choice. Trust me on this one.
I hear you, Hawks, but I need you to understand the gravity of the situation. We can't afford to take unnecessary risks with our patient's health. Let's revisit all the options together and come to a well-informed decision.
Leslie, I just checked on the patient and things are not looking good. The wide local excision didn't work as we hoped.
Oh no, that's not good. We need to figure out the next steps.
I know, but how do we break the news to Hawks that the list of disorders included in newborn screening programs wasn't the right approach in this case?
Frank, the most important thing right now is the patient's well-being. Let's focus on that first and we can deal with the rest later.
You imbeciles. You nearly killed our patient with your incompetence. Wrong wide local excision area and wrong diagnosis. Are you even capable of basic medical practice?
I believe it was a miscommunication, Dr. Hawks. We were considering all possibilities.
I still think it was the correct treatment, given the symptoms and test results we had.
I agree with Leslie. I don't see how we could have known it would go wrong.
Maybe we all missed something in the case, but you can't blame us for trying our best, Dr. Hawks.
Your best? Huh. Your best nearly killed a patient today. I can't believe I have to work with such a bunch of incompetents. I'm done with all of you. Figure it out yourselves. So, how's everything going in your personal life, Johnson?
Oh, same old, trying to juggle work and family time. It's a challenge, but we make it work.
That's great to hear. Family is so important.
Yeah, definitely. How about you? How are things outside the hospital?
Oh, just caught up with this really interesting case. The symptoms are so peculiar, I can't seem to figure it out.
Well, you always do have a knack for solving those complex cases. I'm sure you'll crack it soon.
Wait a minute. I think I've got it. Johnson. I'll catch up with you later.
Oh, sure, no problem. Just leave me hanging here. Good luck with the case, Hawks.
I need to talk to all of you about something important.
What on earth are you doing storming in here without proper gear, Hawks? Better than that.
Yeah, seriously, you're putting everyone at risk. Have some respect for the protocol.
We can discuss your lack of safety later. What do you want to bring up?
I've discovered a mistake in the list of disorders included in newborn screening programs. It's about nephrogenic diabetes insipidus. The prognosis is not good. It's a chronic condition with no cure, but management is possible with medications and lifestyle changes.
Well, we need to confirm this diagnosis before we can take any action. Let's run some tests and make sure we're on the right track.
Agreed. Let's not jump to conclusions, even if Hawks is usually right about these things.
Tracy, I finally found the right diagnosis for the patient.
That's fantastic news, Hawks.
If some of the other doctors weren't so incompetent, we wouldn't have had to go through this ordeal.
What do you mean by that, Hawks? You were the one who initially diagnosed the patient incorrectly.
Well, my diagnostics team could have caught the mistake earlier.
You can't just shift the blame like that, Hawks. Own up to your mistake.
Sighs, I have things to attend to, Tracy.
Hawks, you can't just walk out like this. We need to address this issue together.